We will start with our new chapter, that is thrombosis and embolism. Start with thrombosis. In the last topic, atherosclerosis, I have given the introduction regarding how a thrombus is formed following an endothelial injury or an injury in the internal layer of the blood vessel, or the atheromatous plaque which ruptures. So all these type of injury, it leads to the formation of a clot or coagulation. Blood coagulation mechanism gets activated there, and a clot is formed, which is called as a thrombus, which slowly grows up. So thrombosis is the formation of a solid mass of blood within the circulatory system. It's a solid mass of blood. Beginning from that small clot, it grows up to a solid mass of blood which stays in a particular place, and it obstructs the circulation. So that is called as thrombosis, the process of a thrombus growing and obstructing a circulatory system. That process is called as thrombosis. And there's a important factors which are responsible for the formation of thrombosis. There are three factors. It's called as a Virchows triad. The first one is vascular damage. That means any injury in the blood vessels. It can lead to the formation of thrombosis. Second one is blood stasis or turbulence. So blood stasis means there is a pooling of blood or stagnation of blood somewhere in the blood vessel. It may be due to some valve injury or some valve malfunction, or heart muscles of the heart not functioning properly, like atrial fibrillation, etc. All these conditions I had given the clue in the last classes. So in that case, when the cardiac output is not being proper, the blood stays somewhere and it leads to the formation of clots. Then blood hypercoagulability means hypercoagulation. There are the clotting factors becomes engaged, more activated, forming clots in the blood vessels. So these three are the basic factors. The Virchows triad is very important. The Virchows triad are the factors predisposing the formation of a thrombus or initiating thrombosis. So remember this. The thrombosis is of three reasons, that is stasis, vessel wall injury, and hypercoagulability. So these are the Virchows triad. Now we will see each one of them. That is, first one is vascular damage for the endothelial injury or dysfunction. Atheroma or atheromatous plaques, as I mentioned earlier, is the main reason for a vascular damage to occur, which can initiate a thrombosis. It can be in myocardial infarction or an ulcerated atherosclerosis. In all these conditions, clots can occur. Then a direct injury, maybe of the blood vessels, maybe after a surgery or some treatment procedures. There is a direct injury which causes a kind of clotting inside the blood vessels. Then a dysfunction of the blood vessel. The dysfunction means if in hypertension, the turbulence of the blood flow will be more, and the tension can cause, or the pressure exerted by the blood to the walls can cause kind of injury in the endothelial layer slowly, and it can cause rupture or clot formation. And bacterial endotoxins. These endotoxins can destroy the blood vessel wall. Then hypercholesteremia, cholesterol deposit. Then radiation, effects of radiation following treatment for CA. Then cigarette smoking is also a very important factor for vascular damage. Then abnormalities of blood flow, or the stasis. What do you call as? Turbulence enhances endothelial injury. Whenever there is a pressure is more, or the blood flow is having a turbulence, it can injure the internal lining of the artery. Stasis also enhances venous thrombosis. So example, aortic aneurysm, myocardial infarction, valve stenosis, narrowing. Then rheumatic heart disease, again the valves are involved. There is injury to the valves in rheumatic heart disease. So all this can cause formation of clot. Then abnormalities of blood components like hypercoagulability. Here the blood components or the coagulation factors are abnormal. Example, smokers. In smokers, there is nicotine or some type deposits more in the blood. Then postpartum, after delivery, the chances of coagulation, and maybe following a condition where the small blood vessels in the uterus is being broken while delivery, or due to the influence of estrogen also, uh, the chances of formation of clots are more. Also, prolonged immobilization in bedridden persons, the chance of thrombosis, deep vein thrombosis more. Uh, since the person is lying in supine position, the part which is having in contact with the bed, here small arterioles etc. can be obstructed due to pressure, and later clots can form. Then CA, contraceptive pills, again estrogen, then post-operative conditions. In all these conditions, chances of formation of thrombus is more. Now we'll just see the major forms of thrombi. The major form, that is arterial thrombi and venous thrombi, are present. Again, arterial thrombi can be seen in aorta in conditions like aneurysm, in which there like sac-like structure is formed in the aortic wall, and in which inside of that wall the blood stays and it forms a clot and it obstructs the aorta. Then arteritis, that is an inflammation. Then coronary artery, the atherosclerosis is the most common cause. In the limbs, there is a atherosclerosis can cause again a thrombus, and diabetes mellitus has a more predisposition towards formation of a clot or formation of atheromatous plaques. In diabetes persons, there are more chances of the formation of plaques in the blood. In Berger's disease, a condition, autoimmune condition, where there is, especially in smokers, seen especially in smokers, where there is blood circulation is obstructed to the limbs, following gangrene formation or necrosis of the part. Then Raynaud's disease, again, it's a condition affecting circulation, maybe due to reasoners, maybe constriction due to cold, etc. The circulation is decreased. Then cerebral thrombi, again by atherosclerosis, and vasculitis. Vasculitis, cerebral vasculitis, it is inflammation of the blood vessel wall involving the brain and occasionally the spinal cord, usually characterized by headaches and stroke or a transischemic attack, TIA, that is a mini stroke, that is a temporary loss of consciousness. The transient ischemic attacks, these are all the signs of the vasculitis. Then venous thrombi, mainly found in the veins of the lower limbs, that is deep veins, called as deep vein thrombosis. Then varicose veins superficially, due to the valves of the veins are malfunctioning, the blood stays, leads to the formation of a clot. Again, popliteal, femoral, and iliac veins, usually in post-operative conditions, the chances of formation of clot is more. And these veins have more chances of forming an emboli to the lungs, that is a pulmonary embolism. Chances of a pulmonary embolism are more in this popliteal, femoral, and iliac veins. That means the thrombus, the part of the thrombus, it breaks off and it travels through the vena cava, reaches the inferior vena cava and reaches the ultimately reaches the lungs, that is through the pulmonary artery, and there it can produce complete obstruction in the lungs, that is a pulmonary embolism. Then pulmonary veins, again congestive heart failure. Congestive heart failure means the heart fails to pump completely, all the muscles of heart start functioning, and that means there is stasis of blood in the heart, and then the stasis of blood in the pulmonary veins, it causes clot formation. Pulmonary hypertension, again there is turbulence of blood flow in the vein, it causes formation of clot following some kind of endothelial injury. Then hepatic, again in the liver, due to portal hypertension, same reason, venous thrombi can be formed. So appearances of a thrombi. So we know that there is arterial thrombi and venous thrombi, and we can distinguish it by seeing them. That usually arterial thrombi will be pale and granular, the formation of granular network in the structure. Then lines of Zahn, that is an important factor, to be more predominant or prominent in the arterial thrombi. It consists of a branching framework of lighter platelets and fibrin. You can see in that thrombi there is a lighter side, that is linear lighter side, that is called as lines of Zahn, because it consists of platelets and fibrin, that's why it's lighter, and a bit more darker coagulated blood cells, that is the darker lines. So these lines are called as lines of Zahn, and these are alternative lighter and darker shades. It's a typical appearance of an arterial thrombi. It's an important point. Then usually in arterial thrombi the lower cell contents will be lower, and it's usually mural. Mural means occurs in the walls of the artery. Arterial or the blood vessel wall, mural is indicating attached to the wall. So a venous thrombi, it is soft, gelatinous, deep reddened in higher in cell content. So you can see in the diagram they are deep reddened, gelatinous and higher cell content. So those dark spots, these are venous thrombi. So I'll explain some general topics and differences between arterial and venous thrombi. Usually thrombosis, it can develop in the heart, arteries, veins and capillaries. Arterial thrombi and cardiac thrombi occur at the site of endothelial injury or turbulence of flow. It's called as mural thrombi. Whenever there is an injury or due to a plaque rupture or a turbulence of the flow, arterial thrombi or cardiac thrombi grows at that particular site of injury in the walls of the blood vessels. There is a mural thrombi. Whereas venous thrombi occurs in the areas of blood stasis. Wherever the blood pooling occurs, venous thrombi can occur, especially in lower extremities like deep vein thrombosis or varicose veins, etc. In all these conditions, there is improper carrying of blood towards the heart. So there is stasis of the blood, and where the stasis occurs, venous thrombi occurs. So cardiac thrombi usually are attached to the underlying vessel wall, aorta, etc., and are non-occlusive but can restrict blood flow. Cardiac thrombi or arterial thrombi usually doesn't occlude the vessel completely, but it can restrict a blood flow, whereas venous thrombi can occlude a blood vessel completely. Because it grows in the middle of the or where the stasis is occurring, so it can develop and obstructs the blood vessel completely. Whereas cardiac thrombi, it is in the wall. It is related to the wall, injured portion in the wall, and it grows from there. So arterial thrombi grow back to the heart. That means it is retrograde growth, away from the direction of the flow. That means arterial thrombi, it grows back to the heart. It's called as a retrograde. So the blood flow is away from the heart usually. Okay, away from the direction. So it grows opposite to it. That is retrograde. Venous thrombi, it grows towards the heart. There is antigrades, towards the direction of flow. So towards the direction of flow, that means it goes towards the heart. Always the veins, it carries blood towards the heart. So the venous thrombi, it grows towards the heart. That is antigrade growth. So again repeating, usually thrombosis in arteries, the common causes are atherosclerosis and aneurysm. Then arterial thrombi usually occlude the lumen, common in coronary, cerebral and femoral arteries. That means the bigger arteries. Then venous thrombi or phlebothrombosis, phlebo relates to veins, are almost always occlusive than, more occlusive than the arterial thrombi. These are red thrombi, and 90% of these occurs in the lower extremities. So I listed out the differences between arterial and venous thrombi. So arterial thrombi usually seen in rapid flowing blood, that is arteries and heart, the major blood vessels. Whereas venous thrombi is slow moving blood in the veins. In veins, the blood is comparatively slow moving than the arteries. So slow moving blood is called the cause of venous thrombi in veins. By endothelial injury, arterial thrombi by endothelial injury like atherosclerosis, a rupture can occur. Whereas venous, it is stasis. I explained this earlier. Then arterial thrombi is mural. It is in the wall. It grows from the wall. Then it does not occlude the lumen fully. Whereas venous thrombi is occlusive and occurs the shape of the vessel. It is present. In arterial thrombi, there is pale grey white lines of ZAN with platelets, fibrin, RBC, WBC, etc. Whereas in venous thrombi, the red to blue or dark blue color with more RBC is present. The blood cells are more in venous thrombi than arterial thrombi. Then ischemic, arterial thrombi is ischemic, leading to formation of infarction in an area. Venous thrombi presence, it can cause thromboembolism. That means the detachment of a thrombus from an area and traveling with the circulation and lodging elsewhere. That is thromboembolism. Then it can cause edema, then skin ulcers, then poor wound healing, etc. All these are caused by venous thrombi. Then arterial thrombi is commonly seen in aorta, coronary, cerebral, iliac, femoral, renal, and mesenteric arteries. Whereas venous thrombi is superficial varicose veins, deep leg veins, that is deep vein thrombosis, popliteal, femoral, and iliac veins, etc. Also, vessels of the upper limb. So in this diagram also you can find out the differences. There is the arterial thrombus. It occurs under high shear flow, that is a turbulent flow, when platelet-rich thrombi are formed around ruptured atherosclerotic plaques. So you can see the endothelial injury in that picture, and there is formation of clot in that area of the damaged endothelium. Whereas venous thrombosis, you can see it occurs under low shear flow. There is a blood flow, the turbulence of the blood flow is very low in veins, and almost around the intact endothelial wall. You can see the walls which are intact, but it's just formed because of the stasis of blood in that area. In venous thrombi, you can see they are fibrin rich, encapsulating a large amount of red blood cells in addition to the activated platelets. So always the cellular matrix is more in venous thrombus than arterial thrombus. The next point is fate of a thrombus. So once a thrombus is formed in the blood vessel, we have listed out 4 to 5 reasons. All these are fates. Any of these can happen with that thrombus. It's called as a fate of the thrombus. So the thrombus, once formed, it can undergo propagation or progression, or it can be an emboli, or it can go for an embolization, or it can go for a lysis, or it can go for an organization and recanalization. So all these changes are called as the fate of thrombus. A thrombus can undergo any of these changes. So these are propagation or progression, embolization, and lysis, and organization and recanalization. So the first one is propagation. Propagation means, or progression means, the thrombus can progress in size. More and more cells get attached to it, and the size of the thrombus can increase. That is called as propagation. Enlarge in size to more and more deposition. It is the progressive spread of the thrombosis, usually seen distally in arteries and proximally in veins. So please understand what is distally and proximally. It's an anatomical part. So in the distal part means far from the center, and proximal is the first part or the near to the center of the body or the attachment or the beginning. So these are propagation. That means enlarging in size. Second one is embolization. That means a fragment of a thrombus is transported elsewhere in the vasculature. So it breaks off. You can see in the diagram, a thrombus is formed in the vein where there is chassis. That means you can see the valves. So here the valves are not functioning properly. So in that gap, the blood is staying. So in that, when there is stasis in that gap, clot is being formed. And a part of the clot is being detached. It's called as a thromboembolism. It's a venous thromboembolism, or VTE. So venous thromboembolism, that's a embolization. It's also one of the change that can occur to a thrombus or a fate of a thrombus. Formation of an embolization. So next one is lysis. Lysis means breakdown. So what can happen? Sometimes the thrombus, it breaks down or it gets complete dissolution of thrombus. Here the fibrinolysis means clot formation is decreased due to fibrinolysis or destruction of the clot formation. That is, fibrinolytic system becomes active, and the blood flow. And when the thrombus is reduced, the blood flow is re-established. And it's most likely when the thrombi are small thrombi, they are prone for more lysis. And when the thrombi gets more and more old, chances of lysis gets decreased. So next one is organization and recanalization. I've explained recanalization in the next slide. So organization means scar formation. That is, the phagocytic cells appear and phagocytose the fibrin and debris, and it's a reparative process where repairing of the thrombus or that solid mass is going on, and it results in the formation of a scar. There is ingrowth or activation of fibroblast and the capillaries. New capillaries are formed, similar to the granulation tissues, and here the lumen, it gets obstructed because the scar formation causes the obstruction of the lumen. It's much more solidifying or fibrotic scar formation is occurring, and the blood flow is obstructed completely, almost completely. So this is called as organization, and the next point attached to it is recanalization. So this is a recanalization. Recanalization, here the blood flow is re-established, but usually incompletely. That means I mentioned regarding the organization. In organization, there is scar formation and formation of new capillaries, and sometimes the capillaries are formed through these scars. So you can see in the diagram there is opening in the scar tissue through which the blood flow is re-established, but it is an incomplete re-establishment. So that is called as recanalization. So one or more channels formed through the organizing thrombus. A thrombus which has changed itself into a scar tissue or fibrous tissue, and capillaries are originated through the scar, through which the blood flow is partially re-established, and this condition is called as recanalization. So in this diagram, the fate of the thrombus is being shown clearly. I'll just explain. You can see a mural thrombus and occlusive thrombus. Mural thrombus is the arterial thrombus and occlusive thrombus is the venous thrombus in short, and both can occur these fates. And the first fate is written is dissolution or lysis. The order is different. Lysis it can occur in a new, I explained, thrombus. It breaks down, the thrombus breaks down and the blood flow is regained. So you can see the clear lumen. Thrombus undergone lysis. Second one I have mentioned is propagation. There is a growth of the thrombus, either in an antegrade or a retrograde fashion, depending upon the arterial and venous thrombi. And the third one they have shown this embolism. Embolism, you have in the lumen you can see a thrombus and a part which is broken from the main part, that is an embolus, and that detached part, it gets carried away in the circulation. If it's from an arterial emboli, it can go and produce an infarction in the kidney, brain or spleen or somewhere. So kidney is being shown here, it can go for infarction. Whereas the venous thrombi, it can go for an emboli in the lungs, that is the pulmonary embolism. So this is very important point to remember. It's pulmonary embolism and other arterial embolism. So venous emboli, it brings about the pulmonary embolism. And next one they have shown is the organization. Organization, here you can see the scar formation is being formed again, and that is hard solid mass and it is obstructing the circulation. And the last point is recanalization, and as the scar completely occludes, there is capillary formation. In the longitudinal view, you can see the complete obstruction of the lumen, whereas in the cross-section view, there is a few gaps in the middle that shows the canals through which the partial blood flow is regained. So these are the fate of thrombus in short. So I just mentioned a condition, a pathological condition where there is a widespread coagulation occur, widespread thrombosis of formation is occurring. That is called as disseminated intravascular coagulation, or DIC. Take this as an example of a widespread coagulation condition in the body. It occurs usually in two stages. In stage 1, there is a normal blood clotting process becomes overactive. Overactive blood clotting process occurs because there is a widespread or a large scale tissue injury, and following that there is an overactive blood clotting process, the body trying to heal all this suddenly, and there is generation and deposition of fibrin in multiple areas or organs also. So there is formation of microvascular thrombi in various organs, and this formation of microvascular thrombi in various organs, there is a multiple organ dysfunction due to multiple thrombus is present, and the circulation may be obstructed, and there is organ dysfunction occurring. And slowly stage 2 takes over. There is consumption and exhaustion of coagulation proteins and platelets due to this overactive blood clotting process. After some time, there is consumption and exhaustion. The process gets exhausted, and what happens? This slows down. The coagulation process slows down, leading to bleeding. So there is second stage, it is subcutaneous bleeding or through the nose or mouth, or internal bleeding in the organs can occur. So this condition is called as disseminated intravascular coagulation. So the cause is obstructive abruptio placentae. The condition called as abruptio placentae, where the placentae get detached quickly, suddenly. There's a serious condition, and there is a severe loss of blood. Then toxemias or pregnancies like hypertension, etc. Abortions, then gram-negative bacterial infections, then neoplasm cancer, severe tissue damage like trauma or burns. In all these conditions, there is the chances of disseminated intravascular coagulation. So in short, there is a overactive blood clotting process going on in a widespread in a large area, and slowly the exhaustion of the clotting process leading to bleeding. So a few more points regarding the venous thrombosis. That is, there is superficial, I mentioned earlier, the superficial and deep vein thrombosis. So superficial example is saphenous vein. There is a local congestion, edema, swelling, pain, tenderness, ischemia, and risk of infection is more. And these rarely embolize superficial saphenous veins, superficial venous thrombosis. Whereas deep vein thrombosis, more chances of embolizing or ultimately resulting in a pulmonary embolism. It's popliteal, femoral, and iliac veins, more seen in popliteal, femoral, and iliac veins. A lot of collaterals also are formed since these are major arteries. So the congestion and edema are not prominent. These collaterals can maintain the congestion and edema, and 50% are asymptomatic. The next point is the effects of thrombosis. So we'll just see what all effects an arterial and a venous thrombus can occur. I mentioned all these points, but it's just refreshing once more. Arterial, there are chances of thrombi can produce ischemia, infraction, and usually it depends on the site and the collateral circulation. How much the extent of infection and the effect depends on the site and the collateral circulation present in the area. So if in a coronary artery, it can produce a myocardial infarction. If in a carotid artery, it can produce a cerebral infarction or stroke. So if the thrombus is in a femoral and popliteal artery, etc., it can produce ischemia, infection, and peripheral arterial occlusion disease. Then embolization mainly to brain, kidney, and spleen. That means arterial thrombi and embolus can go to brain, kidney, spleen, etc. In venous thrombosis, the signs are congestion, edema, ischemia, and infection. More predominantly congestion and edema. So in deep vein thrombosis, again there is congestion, swelling, pain, and tenderness. Infection and varicose ulcers are another complications. Embolization is usually pulmonary embolism is the major embolism caused by a venous thrombi, because all the veins it leads to the vena cava, and it ultimately enters the lungs through the pulmonary artery, and it causes embolism there. So it's a severe condition, serious condition, and the cause of death in many post-operative cases, etc.